Welcome to CrackTalk.
Hey everybody, how you doing? Dr. J here. Welcome to this week's episode of CrackTalk. So glad you're here, and I got my boy Scott. How you doing?
I'm doing fantastic, Jay.
All right, and we are ready for this week's episode because this is a hot one. This is actually such a hot nerve you can't even see straight.
It is literally a hot nerve.
100%. No pun intended, but yes, sir. Scott, tell them real quick your little spiel.
Yeah, what we do. So, guys, every week, like I said, we talk about this every week. If you like what we're doing, you enjoy the content, please like us, subscribe to the channel so you know whenever we update or put out a new video, and share it. If you know somebody that can use this information that may be dealing with an issue that we're going to talk about today, share the information. That's what we're doing it for, is to help educate all of you guys out there. So please like it, subscribe to our channel, and share it.
Yeah. So I always like to say, what's the frame of this? We want to educate everybody, so you get kind of top of mind awareness of today's topic, and then we want to inspire each and every one of you, and maybe some of your friends, your family members, your coworkers, that they don't have to live in pain and discomfort, that they can kind of get beyond it with the right kind of help. Yeah. The last one is action steps. So today we're taking a very related topic to chiropractic, because usually we take unrelated and bring them in, but today, sciatica.
Yes.
What's that pain in my butt? Why is it shooting down my leg?
Literally a pain in the butt.
It's literally that.
Yeah.
And so I always like to come up with stats, Scott. Like, is this a big issue? Yes, it's a monster issue. 40% of people in the United States are going to experience sciatica at one or more times of their life. I want everybody to lock that in. 40%, almost half the population, are going to experience that pain in the butt, shooting, numbness, pain down the leg.
I'm one of them.
I'm one of them.
I'm one of them.
So we're like 100% of this podcast right now.
Yeah.
So 40% of you are going to experience it. So if you haven't, it's on its way. The next thing is 5 to 10% of anybody that has a low back problem, or they're in pain or discomfort of the low back, have associated sciatica.
Yes.
And I'm going to tell you, Scott, this week, it must have been sciatica week. It must have known that we were going to have this on
I think it is sciatica week. August, whatever, 16th or whatever. It is sciatica week. My goodness.
Just this morning, I've had the most complicated cases I've seen. I don't know if it's because it just turned 75 degrees for 2 days. Yeah. But one of the main complaints with all of them, they have this low back, and we're going to talk about what creates sciatica and what's the anatomy, but shooting pain down the leg. Yes. Why is it into my hip? It's coming around in my groin. It's going all the way down to my calf. My foot's numb. Feels cold at night. I mean, these are the things that if you're having these type of symptoms, unfortunately, you have one of the levels of sciatica.
Right. Well, and that is something that a lot of times it can be misrepresented as hip pain.
Oh, 100%. 100%.
It's a hip pain, it's a hip pain, it's a hip pain. And then it shoots down, well, it's in my hip. I'm like, well, I get that, but that is the tricky thing about sciatica, is it's starting in that low back. Yep. And then the way the nerve runs down, it can manifest itself or present itself as hip pain or knee pain or whatever.
Or calf pain. Yes. Or I have a torn hamstring. So let's go over the anatomy. Yes. We're deciding, because this is the one thing that the general population doesn't know. When I'm talking to patients, they're like, I don't know why. And they're thinking, okay, why is my foot numb?
Right.
Is there something wrong with my foot? Or why is my calf cramping, like going into a spasm? Or why is my hamstring and quad? Or why am I getting numbness into my groin? Like you said, they call it hip pain. Well, let me tell you, sciatica comes from, there's 24 movable bones in your body, and then you create a little tailbone, looks like a little triangle at the end. The sciatic nerve is compromised of the L4, the L5 nerve root, and then the S1, S2, and S3. Those things come out, and then they create a rope that goes down your entire leg that innervates every muscle, tissue, and organ in your leg.
Wow.
Okay, so that's the sciatic nerve, and that comes on both sides. So it's like almost like a teardrop, almost like two canes.
So that is kind of like the main.
That's it.
Highway down the leg.
Now your L1, 2, and 3 above the L4, those also kind of come down and associate with the sciatic nerve. So that's the anatomy of the sciatic nerve. Now, if any one of those segments in your low back, now what we're talking about is the L1, 2, 3, 4, and 5. That's your lumbar spine. That is your low back.
Got it.
All right? If you have one of those segments.
That's kind of the first, like, if you think about your hips, is that the first?
Well, the L5, then the L4, L3, L2, L1. They stack. So the bottom two are the main part of your sciatic nerve.
So that's that bottom curve.
Yes.
Got it.
So when any one of those nerves are affected, you can have sciatica. Any one of them. So you have an opportunity. There's literally about 10 to 12 opportunities right there. And we're going to talk about different kinds of conditions that bring sciatica on so everybody can be aware of it. This week, it has been scoliosis week. And we call that a gross subluxation. So we're going to start with that. A gross subluxation is where you have a lateral bend in your spine that is abnormal, Scott. And when it does this, let's say your spine bows to the right or it bows to the left. When it does that, it's compressing the nerves that are creating your sciatic nerve. And then all of a sudden you have shooting pain down your leg, or you have all these type of symptoms associated with the nerve being affected here, but you're not seeing it manifest unless in your foot, your calf, your leg, your hip, and like we talked about, in your groin. So understand that. So scoliosis or a lateral curvature can create sciatica. Okay. Next one, disc herniation. People can, I mean, you get this all the time. You get these bodybuilders, they're picking up monster weights. We've seen it in the office. They go down to pick up a gum wrapper, bam!
Or twist, or lift something
what
up and
happens
turn.
Is they get a disc herniation. That disc comes out. Once again, since you know the anatomy of the sciatic nerve now, that disc puts pressure on one of those nerve roots, sciatica down the leg. All right? Now next. All right, subluxation. Bone moves out of place 1 to 5 millimeters, up, down, left, and right. When this happens, it can put direct pressure on that nerve or create shearing of that disc and irritate that nerve root. What do you have? Now we have symptoms that manifest as sciatica. But still, once again, the problem is here manifesting out here. That's the hardest thing, I think, for the general population to get their head wrapped around.
Well, and that's how I was going to just reiterate that is just understanding of the anatomy of that sciatica, and if there is an issue up in that L1, you know, the S.
L1 through all the way S3.
S3.
Yes.
So anytime there is any kind of misalignment or pressure on a nerve in that state, think about those nerves as you stay running all the way down the leg to the feet. And as we've talked about with carpal tunnel, digestion, everything in the body is that nervous system coming from the brain out to that part of it. It can manifest itself in some kind of a symptom.
And it always does.
Be it numbness, tingling, pain,
shooting pain, feels like lightning going down.
I get the
muscle cramping.
Yep. I get the one that starts on my hip. It actually wraps around the front of my leg to the opposite side of my knee. And it is just like a toothache. A throb. Boom,
and so what you find is with people with sciatica, it manifests in so many different ways because there's so many different opportunities. Is it a disc? Is it a subluxation? Is it a scoliotic gross subluxation? What is creating the actual sciatica from your low back? Because that's where it originates. The only thing that is outside of the spine is your piriformis muscle, which is a muscle about this big. It's about that big. It's a small little muscle. It's underneath your glute muscle, and they actually have a term for it called piriformis syndrome. The sciatic nerve runs right under it, and when that muscle goes into a spasm, you also get true sciatica symptoms.
It's interrupting.
And here it is. We can work on that muscle, but often when we pull back the onion layers of it, we find out usually it's the L1, 2, or 3, the nerve roots above that are causing that piriformis muscle to go into spasm. So we have to go in there and we have to get those things corrected. So, action steps.
Yeah.
When you have sciatica, when you're dealing with sciatica, you will know it. I'm going to tell you this. Anybody that has dealt with sciatica, you 100% know you got it. It is not in question.
I'd say if you've ever been on a long drive and you're driving or sitting in a passenger seat and you wonder why you have that pain in that glute, you know, when it's shooting over your leg, guess what? You have sciatica.
You have sciatica. So what do you do about it? And that's the question we all get all the time is, what do I do about it? Let's say you have a scoliosis. Let's say you know you have a scoliosis, or maybe you don't know you have a scoliosis. We deal with that a lot. Let's say you don't know you have a disc herniation, or you do know you have a disc herniation because you had an MRI or a CAT scan of it, right? And you're experiencing these pains. What do you do about it? Well, now I got evidence. I have sciatica. I have evidence there's an issue here. What do you do about it? The first thing I'm going to tell you to do is you've got to go to a local chiropractor and get your spine checked, because this is what we do. Yes. If there's a related topic, this is what we do. Sciatica is in our wheelhouse, and I get excited about it because not when somebody is in that kind of pain and discomfort, but I get excited because when somebody comes in with sciatica, I'm like, yes.
We can see results right here.
And we often see results super duper fast. Yes.
I know in my case, just having the issue that I was having, it was literally that night. Because it got to the point to where I could not sleep.
It happens.
And got adjusted, got my hips adjusted and stuff. And I mean, that night I remember laying in bed going, oh dear God, I can sleep. I actually could lay there and I did not have that toothache pain shooting down my leg.
So if you have this, you have sciatica. And I'm gonna tell you, it's not uncommon, but like I said, sciatica manifests in so many different ways. It's pain, numbness, and any kind of tingling sensation from your low back, glute, into your leg, your upper leg, down into your lower leg, into your foot. So the first thing, action step, is go get your spine checked by a chiropractor that's reputable in your area that deals with this kind of stuff. All right? Let them take x-rays, because you can see a lot of the contributing factors on x-rays. You might have to go get an MRI or a CAT scan. But even if you have those, what has to be done? Well, that chiropractor needs to rule in or rule out if you have subluxation, and then he needs to rule in or rule out if you can be a patient. Right? Is the area stable enough, and can you be adjusted? And then that chiropractor should start adjusting, though, if it's from the subluxation or it's from the disc or it's from a misalignment of the hips or the sacrum, because all of those things, or if it's a piriformis. You know, doing some muscle work on the piriformis as well, stretching the piriformis out. I'm just kind of giving you guys a download of what would happen if you walked in this office.
And it's interesting, you just made the comment, so, you know, all the different things that can cause it. And then at the very beginning, one of our stats was, what was it? How many people with low back pain?
Tremendous. Half the population's in low back pain daily. So 5 to 10% of them are having associated sciatica with it.
So with that, would that be due to the fact that if you have low back pain, you are compensating for that low back pain? Because I'm just sitting here saying, when you said that, I thought, you know, if you start limping, or you said, well, I'm going to favor one side, and then you start seeing that stair step effect, that kind of thing with the spine. That
scoliosis. It absolutely, because when people have low back pain, they are, it's the check engine light we've talked about. It's a check engine light and say, hey, something's wrong down here. Could be a disc, could be a subluxation, could be a gross subluxation like a scoliosis or a lack of curvature. It could be a multitude. It could be a cancer lesion. It could be a cyst. Right? It could be a broken bone. It could be a bone infection. We haven't talked about a lot of those things. That's why going to a chiro,
so whether it be
and getting that area cleared.
It's almost, if you got low back pain, you should be going to, as we always say, you should be going to have your spine checked regularly
100%.
Anyway. But the point I'm trying to make is, you may have a little bit of a low back pain. You're putting it off thinking, oh, it'll go away, or I'll take this over-the-counter medication and get rid of that pain, but we're compensating for it, which then will manifest itself into a sciatica issue.
It almost 100% of the time.
Well, it says here 5 to 10% of people
are diagnosed with it. But I will tell you, what we see is it's close to 100 that have pain here. They're having pain into the groin, into the glute. They're just not having the shooting pain all the way into the ankle, into the foot yet. And if it gets worse, the low back lesion, if it gets worse, whatever it is, it will start to manifest. It can't help itself because those are all the nerve roots that are coming off. As soon as the lesion is big enough, whether it, like I said, could be a cyst, could be cancer, could be subluxation, which is what we treat, gross subluxation, which is what we treat, right? Disc herniation, which we can help treat through manipulating the spine and getting the muscles, ligaments, tendons stretched out. So if you're having this kind of symptom, first off, I want to apologize because it's terrible. Right, because like you said, you can't get to sleep. You can't find a comfortable a position to get to sleep in. It's hard to walk around. It's hard to even live.
I've actually made the comment. I was like, look, the pain that I'm in, get rid of it.
Cut the leg off.
Get rid of it. I mean, it is that bad. It is like, look, if I can actually go to sleep, I will lose this thing.
Take the leg.
If I can drive 2 hours without the pain, I'll lose it. You know? So it gets that bad.
It gets that bad. And it's almost like if you've ever had an abscess tooth, it's relentless.
100%. Once it starts, you may be up walking thinking, oh, I'm good. As soon as you lay down, boom, it starts. And it just goes and goes.
So find a chiropractor.
Get your spine checked. Get your butt to a chiropractor.
Get your sciatica butt to the chiropractor. Next one is you got to stretch.
Yes.
And you've got to exercise. And when I say exercise, it doesn't mean go and lift weights. This is another one of our action steps. First one's going to chiro. Next one is you got to keep moving because you got to keep blood flowing, especially if it's piriformis syndrome. You got to keep those discs in your low back moving. You can't go sit on the couch and do nothing because I'm going to tell you what's going to happen is those discs will just continue to dehydrate. And the sciatica usually, and the low back pain associated with, usually gets worse. All right. The next one is you got to stay hydrated. Well, I was just on a podcast where we're talking about why do we shrink as we age? Well, it's very simple. As we shrink because we age, let's say spine's this tall, right? And you got 23 discs in there, and they all lose a couple millimeters. Now you've lost about an inch. Now they lose a couple more millimeters. You lose another inch. So, I think I started out my life at about 5'11", right? Now I'm 5'9 3/4. And it's because, you can look at my x-rays square as day and see I've lost disc height in my neck, and I've lost almost my entire L4 and L5 disc from playing sports. It's one reason I'm so passionate about getting this information to you all, is because I'm living through this. Not only am I a student of chiropractic, a huge advocate of chiropractic, I am a patient.
Yes.
And we talked about that. It's prevented me from being on drugs. And I've not had surgery on my low back, which I'm very blessed, right? And it better not happen today, knock on wood. But it's one of those things where stretching, strengthening the low back and the legs are paramount. And then the last one is just staying super duper hydrated, because the way your discs go from flattened out to pumped up is you've got to have motion, because the disc absorbs fluid from the fluid around it.
Okay.
And if there's no fluid around it, what happens is it can't absorb anything, so the disc height can never be restored. And there's different types of therapies for restoration of disc. There's decompression. There's surgeries where they have artificial discs now. But I just always try to say, start holistic first if you're having this kind of pain in your low back and any type of the associated stuff like Scott talked about, like I described, that is sciatica, right? A pain in your butt and a pain down your leg. You've got to take these action steps immediately, because I'm going to tell you this, it does not get better on its own usually.
No, if anything, it gets worse.
It gets worse.
It gets worse.
Yeah.
So think about the action steps is getting seen by a chiropractor,
Yes.
getting adjusted, stretching.
Stretching and strengthening, I would say. Yeah.
And staying mobile. I mean, that is the one thing,
Yep.
we've talked about it multiple times before in our previous podcasts, is just this sedentary type lifestyle that all of us seem to live sitting at desks and watching TV or the
100.
onset of phones, and we sit and watch TikToks or whatever the world's going on. We've become
laid back in that couch in a hunched over
We've become
position.
more and more sedentary, which does not help at all. So getting up and getting moving.
And here's the deal, though. Almost 100% of the patients that have been to a medical provider, Scott, that I've talked to, have all been told, stop doing anything.
Yes.
Stop going to work, stop moving, stop doing this. And I will tell you, if you're deadlifting, stop deadlifting. If you're squatting, stop those kind of things. But you can't stop moving,
right?
Because movement is what helps facilitate healing in that low back by getting blood flow and hydration into your low back. You understand what I'm saying, right? So I don't like when I hear they've been told, we did the podcast, degenerative arthritis is not a death sentence.
Yeah.
Because sciatica usually is due to degenerative arthritic changes, unless it is the piriformis syndrome.
Right. Well, and that's interesting. You say, in the medical field, go home and do nothing. We are like the exact opposite of that. Our message is to do anything but that. Get out, hydrate, stay moving, make sure if you are working out, doing weights and things like that,
back off a little bit.
If something's coming up, go see a chiro and get your proper movements down.
That's it.
Reevaluate how you're doing something, because you may have gradually accepted a bad habit of bending when you're doing something that's creating this
And talk
issue.
to your chiropractor about it. The biggest thing that I see with sciatica is it is so painful. And what people associate pain with and then they say, well, the problem must be this big. And the problem usually isn't this big, it's this big. And it's creating a massive, painful condition in your life. And that's why I say I almost salivate when somebody comes in with sciatica and low back, because we are so effective in the chiropractic profession of treating that with the adjustments and then the associated rehab that you guys see around here, that we get people well fast. It's usually not instant, but 1 to 2 weeks of care, it's gone. And I have an explicit story. We had this little patient named Brittany. She was going on vacation, and she was having sciatica, low back. I mean, you name it. Barely could walk in the office. So we're talking about a young lady, probably in her early 30s, mid 30s, and she says, "I have 4 weeks to get better. I got to go to the beach."
Oh, this is a fantastic. Yes. I know this story.
And by God, in her second week, she could not believe it. And this is somebody that eats, sleeps, and breathes every day of her life inside the medical profession.
Right.
medication, surgery. These are the kinds, working in the ER. So blessed to have her as a patient. Also blessed that she was able to go on that vacation because she thought the magnitude of the problem was going to be this big. Almost to the point where we see a lot of people, Scott, in the office, they've given up hope. And I hope people get from this podcast, as we educate you and get you inspired, that we instill some hope in you if you're dealing with sciatica. We're instilling some hope possibly in your loved ones, that you can share this with them and say, hey, look at this, watch this. There is hope that, you feel like your leg, because it gets to the point like chop it off, amputate this thing. And I don't know if you might still have some phantom pain because the problem's really up here. But you get to the point where you get that hopeless state. And this young lady was in that hopeless state and was just like, I hope you could do something. And I said, we got you. And we go to work. And, I wish it was like, instant. I would prefer that. I would prefer that we adjust people one time, but you got to first find a chiropractor that's going to be able to deliver the goods that we're talking about. Not just the adjustment, but they're doing associated rehab, and they have a lot of different ways of performing adjustments to make sure they're hitting all those potential differential areas of your spine that could be contributing to sciatica, because it's not a one size fits all.
Right.
We're talking about all those nerves. There's 5 on each side that rope it down, and then there's multiple nerves that kind of come to those that also are involved. You're talking about a lot of things that could contribute to your sciatica, contribute to your sciatica. All right, so that's all I got today, man. Anything else you want to ask, Scott?
I just real quick, that is something that you made a comment here just a minute ago. The problem seems like it's this big, because I tell you, if
pain's that big.
If anybody is dealing with sciatica or has dealt with sciatica, it is a big pain. And I see what you're saying. I hadn't thought about that, and I'm like you, that when I see somebody or I talk to somebody out in the community that says, I've got sciatica pain, or I got the shooting pain down, and I'm like you, I salivate, because I am like, I can help you. If I can get you into my clinic or get you in a clinic,
a miracle's going to happen.
I'm like, get to a chiropractor. I don't care if it's Core Health Centers, which is us, or another chiro. Get to a chiropractor. You can get help.
I'm going to tell you, you're sitting here watching a podcast with a guy that at 23 years old, myself, had a massive disc herniation at his L5, which is the last disc in your spine, and it completely, which is classic sciatica, my entire left leg stopped working. I couldn't feel it. I couldn't touch it. I couldn't use it. My poor wife, we had just gotten engaged, and I was almost, I couldn't walk. I was hopping on this leg. I'd have to hold her. She'd have to help me in and out of the car. Help me use the restroom. Is one of the most embarrassing couple weeks of my life. And what happened is I first went and I got, I didn't know, I just started school, and I went and got a steroid shot and some medicine, and it did nothing except for numb the pain a little bit. And then I overexerted myself because I tried to walk. The leg still did not work. So I'm going to tell you, my left leg works now. It took me getting adjusted twice a day for about 3 to 4 weeks, and then I moved down to once a day, and then I moved down to about, I think I got to about once a week, and I'm still at that. I get adjusted 1 to 2 times a week, and I'm not saying that's for everybody, but with my lifestyle, with working out, with adjusting, that is what keeps me away from the brown little bottle, and it keeps me away from the knife. So I'm okay with it. And so I just want to tell you, I was at the deepest, darkest place of my life, and back to the magnitude. I was like, I thought I was going to be like this for the rest of my life. Couldn't even feel my leg. Now it took 2 weeks, some feelings started coming back, and 6 months later, here's I'm going to manage expectations. 6 months later, Scott, I was still only about 70-75% better because of the type of injury. And then we roll back the reel. I'm a drummer, popping in the seat like this, hurting my L5 disc, and wrestling and football had contributed to my L5 at 23 just saying, we're done. So if that relates to any of you, or if you're dealing with anybody in your life that is dealing with this kind of painful situation, first empathize and sympathize with them. The next thing is get them this CrackTalk so they can listen to it. The next thing would be action step. Get them in to see a chiropractor. Make the phone call for them and bring them in, because there's hope that they don't have to live like that.
That exactly, 100%.
So if you like today's content, make sure you like it.
Yep.
Make sure you share it. Make sure you subscribe to this channel because we're trying to build this thing because we want to help more and more people like myself, like Scott, like you all that are dealing or have dealt with sciatica. And if you haven't, it sounds like with the stats, it's on its way into your life. Because we're all living in this world and it ain't easy, okay? The next one is make a comment. Make a comment about this podcast. Make a comment of any topic.
Yeah.
We like to get feedback to help direct and navigate this ship.
Yep.
So Scott, anything else you want to add,
No,
man?
I'm good, sir. Great topic.
All right. Well, thank you for all joining this week's episode of Crack Talk. You have a great one. We'll see you next week.
See you guys next week.